Hello, we'll be discussing respiratory syncytial virus, otherwise known as RSV. My name is Hannah Zilke.
And my name is John Rikoski.
Here's a short video about RSV. It'll be a quick summary of the information we will cover in this lecture.
A cough, a sniffle, a wheeze. These symptoms seem like the beginning of a cold, but they may actually be the start of something much worse. RSV. This seasonal virus affects nearly all babies before they turn 2. While this virus can be a danger year-round, babies and young children are more likely to catch it during RSV season, which typically runs from October until April. Babies with RSV may experience a cough, a runny nose, wheezing, exhaustion, a fever, fewer wet diapers, and difficulty breathing and eating. While some symptoms may seem common, RSV can lead to other serious conditions, such as bronchiolitis, pneumonia, and severe respiratory distress. In fact, the symptoms can become so dangerous that babies and young children need to be hospitalized. RSV is the leading cause of hospitalization for infants less than 1 year old. So what can parents do to protect their babies from this scary virus? They can practice good hygiene, avoid crowded spaces, stay away from people who are sick, and clean toys and surfaces. RSV can be scary, but by learning about the virus and taking precautions, parents can help to protect their children from serious complications and long-term consequences. To learn more, visit infanthealth.org.
All right. So now we're going to go more in depth about RSV. What is it? RSV is a viral infection that affects the lungs and respiratory tract. This disease invades the nasopharynx, which causes the airway to become obstructed. Breathing in, inspiratory volume remains the same, but the breathing out, expiratory volume, is impacted. They are unable to exhale air fully. This is a highly contagious disease, which can be spread through direct contact, which would be coughing, talking, singing, or touching an infected object, which would include door handles, tables. In the United States, RSV season begins in September or October and ends around April, May. Severity depends on age and if there is a history of chronic health conditions. Adults tend to have a common cold, symptoms like a runny nose, low grade fever, headache, or sore throat. In severe cases with infants, you can see shallow, rapid breathing, poor feeding, unusual tiredness, irritability, and periods of apnea, which is when the infant stops breathing for a period of time, typically about 10 seconds. Hospital stay is highly suggested if your infant is having difficulty breathing, has a high fever, and has bluish skin, especially in the lips or nail beds.
There are a few risk factors of RSV. The populations that are higher risk for RSV include young infants, which are 6 months or younger, and especially premature infants. Children or adults that have a pre-existing heart disease or a chronic lung disease, children and or adults that have a weakened immune system, and children that have a neuromuscular disease. Also, older adults at the age of 65 or older are at a higher chance for severe infection. Testing should be performed a few days after symptoms are present. There are two different types of sample collection. One is a nasal aspirate or wash, where a healthcare provider will insert normal saline in the nose and cavity and gently draw it out. The second is a nasal swab test that uses a special swab to collect a specimen from inside the nose. Sample collections may be uncomfortable, but the discomfort is only temporary. Positive results will indicate the presence of RSV. There are two different types of tests. One is a rapid RSV antigen test, which is the most common. This test will look for antigens in the mucosal membrane, and you will get results in less than an hour. The second is a molecular test. This will look for the specific genetic material of RSV. These samples need to be sent off to a lab and is often used in adults or older children as there's less protein in the nose when compared to infants. It also may be included on a respiratory pathogen panel, which simultaneously screens for other pathogens.
Okay, there's no official there's no official vaccine for RSV yet, but during RSV season, infants can get a palivizumab monthly shot to help prevent RSV. Treatment is typically focused on supportive measures. These would include supplemental oxygen, suctioning, hydration, and possibly a bronchodilator like albuterol. If your infant is at higher risk for getting RSV, prevention is key. This would include washing your hands, clean and disinfect surfaces, avoiding close contact with sick people, and keeping your hands off your face. Okay, we're going to test your knowledge. If you need a little bit of time just to think about the question, you can pause the video and then press play when you're ready. Our first question is, when is the start of RSV season? Is it A, March, B, April, C, September, or D, December? The answer is C, September. RSV season starts in September and October, around that area, and will end in April, May. How can you prevent exposing RSV to your high-risk infant? Would this be A, not covering your mouth when you sneeze, B, touching your face with dirty hands, C, being around sick people, or D, washing your hands? The answer is D, washing your hands. This is the number one way to help stop the spread of infections. The other three options listed on the previous slide would be ways that could cause the infection to come on you, and then that could infect your child.
True or false? RSV can affect older children and adults.
A, true, B, false.
The answer is true. While healthy older children and adults typically have symptoms that are attributed to the common cold, they can still have RSV. To summarize today's information session, we have attached an infographic as a quick summary. This will focus more on infants with RSV.